Psilocybin has previously been thought of as a recreational drug, but research is finding its uses in treating ailments and disorders including cluster headaches, obsessive compulsive disorders, anxiety, depression, and addiction. For the purposes of this presentation, I'll be focusing on the therapeutic use of psilocybin in treating depression, anxiety, and in acceptance of death. The long-term benefits we'll see after ingestion of psilocybin are indicative of increased neuroplasticity, allowing patients to reappraise past feelings that may be causing depression and anxiety. A study was conducted that administered 2 separate doses of psilocybin to 20 patients that have been experiencing moderate to severe depression for a mean score of 18 years. It's worth noting that all patients had tried at least 2 other treatments in the past, which yielded no significant results. In this study, no patients sought other treatment during the 5-week period after psilocybin. An fMRI analysis of the amygdala found that after taking psilocybin, subjects had a stronger response of amygdala activation when seeing fearful faces than they had prior. Other pharmaceutical antidepressants expect to show a decreased response, which may imply that patients are simply avoiding these negative emotions as opposed to treating them. With psilocybin, the decreased depression severity is linked to patients confronting their emotional trauma. So rather than avoiding these negative emotions, they address them and work towards resolution. Although psilocybin does yield positive results, it is not advised to self-administer these drugs, because to achieve maximum benefits, one must be under the guidance and supervision of trained professionals. Otherwise, adverse effects may arise. The effects of psilocybin alone may not yield the desired results, but this study shows that psilocybin, in conjunction with therapeutic sessions, provides both short and long-term effects on the decrease of depression severity. Further research is needed, but these findings suggest that therapeutic sessions while under the influence of psilocybin are not only safe, but could also be a better alternative to other pharmaceuticals typically used to treat depression. This study yields strong results in the efficacy of psilocybin on the treatment of depression and anxiety in patients with life-threatening cancer diagnosis. Just as we saw in the previous study, we see a decrease in depression and anxiety in both short and long-term measures. Patients diagnosed with life-threatening cancer often show decreased mood, anxiety, and an overall decrease in quality of life. Depression has been shown to be an independent risk factor of early death in cancer patients. Other treatments have been used, such as antidepressants and benzodiazepines, but their efficacy is limited and often come with negative side effects and a risk of withdrawal. The sad truth is that many of these patients are aware that they're going to die, so what's important is finding a way for them to come to terms with this reality by accepting their death. The overarching anxiety towards death is shown to be alleviated after administration of psilocybin, allowing patients to live out their lives without the added depression and anxiety that stems from a fear of dying. As more research is conducted, we're starting to see real alternatives to the typical depression and anxiety treatments using pharmaceuticals. As opposed to numbing these emotions, psilocybin, in conjunction with therapy, allows its patients to confront these emotions, leading to acceptance and an overall improvement in quality of life. As the research continues, we may soon realize that psychedelic-assisted therapy could be the better approach to treatment of depression and anxiety, as the side effects are minimal and the therapy seems to provide long-lasting benefits. Thank you.